All right, I'm live now. Welcome everybody to a whole new episode of Major Listen. I'm gonna get the good vibes going with the little background music. We got a special guest today, a person that I am very interested in getting to know. So everybody, please welcome Miss Shawna Greer. Did I get that right?
You did.
Awesome. So welcome to Major Listen. Of course, I wanted to ask you so many questions before the episode started, but I couldn't because, like I mentioned, it just feels right to just get to know each other when everybody else does. So, how are you? First off,
I'm good. It was a long day today, so
was
I'm
it?
glad. Yeah,
What,
yeah.
when is the busiest day for you guys?
During my week, Wednesday is the busiest day for me.
Wednesdays. And
Yeah.
why is that? Like just crammed
I
everybody
have
together.
I work assisted hygiene
Uh-huh.
on Wednesday and Friday, and so Wednesday I have like 2 columns that I work from with an assistant,
Oh.
and so I can basically fit the most patients on Wednesdays.
Ooh.
Yeah.
So give or
So
take.
you make the frown face. It's a good day. It's
Is it?
okay.
Okay.
Yeah.
See, you made it sound a little stressful to me. I was like, oh
Yeah,
my God, is that
no.
stressful?
I mean, it could be really stressful, but I have a bomb ass assistant,
Okay.
and she helps. I can see 14 patients in a day, and
Oh, okay.
it's fine.
Hey, if you have a good
But-
team, then you're good.
Yes.
That makes everything
Without
just go
her,
faster.
it'd probably be super stressful and not happening ever. So.
Awesome. Oh, but please, before we go ahead and continue with all the hardcore questions that I'm gonna ask you, can you please tell us a little bit about yourself?
My name is Shawna. I've been a hygienist for 8 years, almost 8 years now. I graduated from the University of Texas School of Dentistry in Houston. I am a member of the Dental Hygienist Association. Currently, I'm president of the Texas Dental Hygienist Association. So I'm very involved in that, and I love networking and doing all the things. Volunteering with that is a lot of fun. I have 2 boys. They're 24 and 22. We all 3 play the cello. You can see one in the background. So we play. Yeah, you can see back there. I just realized that we play in the community orchestra here in Kingwood.
Oh, okay.
I don't know. What else?
So you're local. You're here in Houston, and I just barely found that out, of course, because you were referred to me by one of our good friends, Lee, which she lives in Dallas. But yeah, it's crazy because I absolutely had no idea that you were here in Houston. So that's pretty awesome.
I thought you were in Dallas, so
See, vice versa. So yeah, shout out to Lee, by the way, over there in Dallas. Thank you for making this conversation happen. Like I mentioned, I have no idea who Shawna is. I'm looking forward to getting to know her because this conversation is gonna be like I'm gonna be learning a lot from her, the same as you guys. So it's gonna be pretty interesting. So I guess we can go ahead and start with our first question. Pretty sure you get asked this plenty of times. What made you choose your career path?
So I think my answer for this is a little different than most. This is like my second career of my adult life. I was originally working retail, and I worked community customer service manager. I worked stock, product presentations, all that kind of stuff. And the job that I was in, my position dissolved, and my fiance at the time, we're married now, when I lost my job, he was like, "What do you want to do?" And I had never had anybody ask me that, I guess, before.
Mm-hmm.
And so I was like, well, I need to go back to school because I don't want to do retail anymore because it will suck the soul out of you.
Yeah.
And so I was trying to pick like, what do I want to go back to school for? I had originally gone to school for orchestra. I was going to be an orchestra director when I was in high school. But that would have taken a lot more schooling. And it's harder to get a high school job because there's only a few high schools in your area. It all ended up with me going and getting into dental hygiene. And
now, did you want to do it from the get-go?
No, I had never. It was never even on my radar. And honestly, whenever I started looking at the schooling and stuff, I was like, you know what? I could be an assistant. like that. That would.
Hold on, Shawna. I for some reason I can't hear you.
Oh no.
Okay, there you go. I don't know what happened,
Oh,
but for some
I don't
reason,
know.
yeah, I was like hearing a lot of mumbling out, but I knew you were saying something. Uh,
Can you hear me? Okay.
yeah,
Now?
I could hear you
Okay.
now. Yeah, I forgot
So
what
yeah,
you
I
were.
thought I was like I was going to be an assistant, is what I had originally thought, and then I looked at schooling and what the differences were between assistant and hygienist, and the school that I live by had a hygiene program, and I was like, okay, I'll try that and see.
See how it
And
goes.
then, yeah,
Wow.
yeah.
And how do you like it so far? I mean, I know it's been 8 years.
I love it. I love my
Really?
job. I love working clinically. I just started last year working as an adjunct faculty at the community college here in Kingwood. I work there on Mondays when the students are in clinic, and I really, 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 really enjoy it.
Okay, so absolutely, you've been there 8 years, so pretty sure there's a little passion right there that you like.
Yeah.
Awesome.
And there's so many different things that you could do as a hygienist. You don't have to. You're not just stuck in an operatory, and that's the only job that you're able to have.
Okay.
So I like that.
But can you explain to me some of those things that you can do?
Education. You could be a CE speaker, whether it's virtually or in person. You can work for different dental companies. They have different educational things that you can do with them. Educating offices about their product, social media influencers stuff, product influencers. There's so many different things.
I'm noticing that you advertise a lot of things on your Instagram as well. Now, do you network with a lot of people that like partner with them, I guess you could say, with a lot of people that give you that?
Yeah, I just started doing that a couple of years ago, and the best way to interact with the companies and exhibitors and stuff like that is going to the annual conferences. Lee is so cute. I miss you, Lee.
See, she really gassed you up.
She's amazing.
She kept telling me.
She's a mess. I miss her. And just getting to know the exhibitors and the people who work for the companies, and then getting the product in my hands so I can review it. And that was the whole reason behind doing the Try RDH. Because if you don't go to those kind of conferences, you don't really know what technologies out there, what kind of products are out there.
Absolutely.
And that way, if I get my hands on it and I can share it, then everybody can get to know.
Yeah, it's a win-win situation. And you're staying up to date to all of with all the technology that's currently being worked with by by your profession, I guess. And I think that's good. I think it's important to stay up to date with everything. You definitely don't want to get caught in or stay in the past.
No.
So the things that you're currently working with, like, how do I say it? Where was I going with this question? Are they making your job a lot easier?
Yeah, a couple of things that I've gotten to know from doing the Try RDH is there's a couple of different attachments that goes on my chair. One's called the centipede, and it holds the suction, and it's easier, more ergonomic for me because I'm not reaching around all the time. I can just kind of go up and down with it.
Oh, okay.
Different instruments that I get a hold of. Yeah, they make my job easier for sure.
I'm gonna definitely bring some of those videos up so everybody else can see later on right here, because there was one that I was really like, I don't know, really caught my eye, so I definitely want to bring that one in.
It's probably the centipede. That's the most famous one, I guess, that people really ask questions about.
Oh, if you have it on there, I want to see it, but it wasn't that one. It was actually the ear one.
Oh, yeah.
That one was pretty interesting. I was like, So I definitely.
Yeah, it's loud in the operatory. Those instruments and the stuff that we use, it's loud.
Okay, you know what? I'm gonna just go ahead and pop it up right now. Hold on. just so everybody can get an idea of what exactly we're talking about. Give me a second. Share screen. All right, so that
Oh yes.
the ear protection we're talking about is this one right here.
Yes.
I don't know if you guys can hear
I'm talking
her.
about this. This is just my earbud. I listen to audiobooks while I'm cleaning teeth, but on the other side, I do wear protection. These are from Eargasm. These are silicone, I think, and they have a little speaker that allows me to hear when I am wearing them. So it doesn't completely block out all of the sound. It just protects my ears from the loud dental noises that I hear all day that are really close to my ears.
Yes.
So they're called eargasms.
Yeah, look, I didn't make up the name.
No, that's pretty interesting. I like the name. I don't know why. It's just it's very catchy.
You won't forget it. Yeah, exactly.
Yeah,
you won't forget
it definitely rolls off the tongue real easily.
Mm-hmm.
But I thought those were pretty interesting. And do they actually work?
Yeah, I've been using them for, I want to say like a year now. And so I do wear one in my ear so I can, listen to my audiobooks because this keeps me sane. But I put the other one in here, and it's like a little speaker on the outside of it.
That you can
I can hear. Yeah, mm-hmm. Yeah. But the high frequency tools that I use, it
cancels it
blocks
out.
Blocks that. Yeah.
Oh, okay. Cool. I'm definitely gonna look into that eargasm.
But you can wear them like at concerts, or if you work outside, like you can use them for
pretty much anything.
Concerts. Yeah.
That's awesome. Good thing you're promoting it right here. That's pretty neat. I definitely want to get into that other slide that was right next to it because I'm very interested in how do people get not gallstones, tonsil stones. Tonsil stones, yeah. So I'm gonna bring that right back up. But I was looking at this one.
I don't have. That's just the best. That's the best picture you're gonna get. I don't get tonsil stones, so I didn't get to really show my tonsil stones. But
okay,
the tonsils that everybody. Well, if you still have your tonsils, they've got these little caverns, these little nooks in them, and bacteria get stuck in there, and over time will create that pus pocket. Basically, is what it is. And that's your tonsil stones.
Wow. And is that painful to the person who has it?
I mean, it depends on how big they get. They could get kind of painful because your tonsils will swell up, if they get pretty big. But the worst part is they smell really bad. Yeah.
Oh my God.
So if you have bad breath and you've tried all of the things to get rid of your bad breath, chances are you probably have tonsil stones.
How common are tonsil stones?
I don't know. I don't see them that much in my patients, so I don't know that they're very common, but they're common enough that, they make products for people who have them.
Wow. Ugh. From a scale of 1 through 10, how bad does it smell?
I wear a mask, so honestly, I don't smell much at all. But it is pretty rank. They're pretty rank.
Wow. All right. That's pretty interesting. I really wanted to know about that because I was like, I heard about them. I just don't know how people get them. And
I used to gargle with salt water or mouthwash to help keep it clean, but sometimes that doesn't help.
And you guys use instruments to scoop them out, or?
Well, no, not technically. I don't do that to my patients, but those are things that people can buy to use at home.
Oh, okay.
Yeah.
Okay, so it's you basically have to do it yourself.
Yeah.
All right, let's go to the next question. Can you share some tips for maintaining good hygiene?
The best tip is consistency and just doing it. You'd be surprised. People just don't brush their teeth, or just don't floss, or they only floss and brush. Look, I see your face.
I'm a
do
bleeder.
You wipe every time that you go to the bathroom?
How did I know somebody was going to ask me this question, in the future? And here you are asking me that question.
If you do that, then you can brush at least once a day, right?
It's not the 2 minutes. It's just the flossing.
Okay, yeah, I know. The flossing. I'm really bad at not flossing too. And I floss people all day long, so I get it.
Like I said,
There's things to kind of, that's because you're not flossing.
Good point, right?
Yeah.
But hey, you got me there. So definitely maintaining and keep up with it.
Yes.
All right.
Yes. And just find a routine. like the best way that I can floss is I don't have a container, but I have a little floss container with the little floss picks,
Mhm.
and I keep that in my lunch kit. So then when I eat, I see it, it sees me, and then I don't have, an excuse. Leah's got jokes tonight. Look at her.
She cleaned my teeth once.
One time.
And then she left.
That's funny.
That's the
And
last
then
time.
she left.
That's the last time I went to the dentist, Lee, by the way. It's because you weren't here anymore.
Oh. Oh, wait, did you go to the school as a patient? Or when she was working?
She was working here.
Oh, okay.
She was working over there in spring. That's messed up.
Man.
Hey,
See,
don't listen.
You live right down the street from me. Well, the long street.
The long way, but yes, I
Yeah.
can literally. It's a straight drive. Literally,
That's
a straight
right.
drive.
Yeah.
Well, maybe we can get something going. Like I said, I'm really like I get really anxious when I go to the
Anxious?
dentist. Yeah.
You're not the only one.
Oh, that was gonna be one of my questions, and I forgot it. Write it down. How do you deal with patients who have anxiety?
The best way that I've found is just making sure that they know that I hear them and acknowledge that they're anxious, because I get it. I mean, I get anxious about stuff too. Is it silly to be anxious to come see me? I think it's silly because I'm not going to hurt you, but I get that that's the whole thing about anxiety is you sometimes don't have a control over it. So just kind of working with the patient and explaining everything in detail. Like, okay, today we're taking x-rays and then we're going to do this and then we're going to do this. And then, that's my husband. Yeah. He didn't see me as a patient until after I graduated hygiene school. Like a few years after I graduated hygiene school, yeah, because he gets super, super anxious.
Oh, okay. So I'm not alone in this.
No, you're not. Every week, every day, almost, I see at least one person that's anxious. I have patients that I've seen for years now, and they tell me, I still don't like coming to see you, but because it's you, I'm coming.
Oh, so I guess it's just your energy that
Maybe.
makes them comfortable, I guess.
Maybe.
Oh, hold on. I hope you get comfortable enough to go again.
Yes.
Yeah.
That's the part too.
We'll see what we can make. We'll see if we can make something happen. Like I said.
Okay.
Who knows? Maybe you guys will see me there. You got? Are you comfortable with telling people exactly where you work? I don't know if that's.
Oh yeah, I don't care.
Where
I
exactly
work at Caris Dental in Atascocita.
Oh, okay. I'm gonna have to write that down because I have no idea where that's at. No, I know where Atascocita is.
Yeah. If you Google Caris Dental Atascocita.
Okay.
It'll take you.
Gotcha. And I guess back to the anxiety and dentists and anxiety. So how do you comfort them? What do you do? What are some tips that you can give for those who have really bad anxiety? Because I'm gonna tell you a little story about myself.
Yeah, go ahead.
When a previous time that I had gone to the dentist, they gave me like the numbing shots, I guess.
Mm-hmm.
Well, it caused a really bad panic attack. So I freaked out.
Yeah.
I didn't know what was going on. I was like, I can't feel my face. But of course you can't feel anything. But I freaked out. Like something told me like this isn't right. What's going on? And I freaked out. I got up and left. I told him like, no, thank you. You know, I gotta get out of here. I literally flew instead of just fighting it. So that was my experience, because I have really bad panic attacks, and that's what caused it was the dang shots. But of course, you know, they need to tell. I feel like they should have told me a little bit better. You're gonna get a little
like you're not gonna feel anything, and
but
it's hard because what else do you do in your life where you're laying down completely at, you don't know anything that's going on. You can't see, you can't watch, you have no idea what's going on behind you. And then if you're numb, you can't really feel. So it's always like the anticipation that something is going to hurt. It has to. Something's going to hurt. So you're like this the whole time.
Mm-hmm.
No, I get it. We have, I don't have one here. We have like little squishy balls that patients can use.
Uh-huh.
Or I tell them to bring earbuds, like blare music, blare an audiobook, blare a podcast,
Really?
something that will distract you. Because I don't have to talk to you. Like, we'll get all our talking done,
Mm-hmm.
and then you can listen to your book. I'll listen to my book, and it'll be fine.
Oh, okay.
They wear sunglasses. Like, you have to wear protection.
Yeah,
anyway,
yeah.
But I like to give sunglasses just because it makes it a little darker, kind of helps relax you. I've even turned off my operatory light before, just to kind of give them, try to calm them down as much as they can.
Your husband said
Yeah.
Shawna does a really good job of telling you what she's doing and what's happening.
Yeah.
I feel like that would make people a little bit more comfortable. Yeah.
Right.
Giving them an
you don't know
idea.
what's going on. Yeah.
Yeah, giving them an idea of what exactly is going on, instead of wondering like, oh God, what's gonna happen? What's this? Is it gonna hurt? All these questions are just, in your head. But
yes.
Hey, if you can do that, I feel like that'll help a lot of people. So your imagination doesn't destroy you.
That's what I mean. You just
Exactly.
start thinking all the what ifs.
Mm-hmm.
Oh my gosh, it's going to. And if you're like this the whole time, I'm going to be like this the whole time. And it's not a good time for anybody.
I think she even gave you a laughing gas, but you got more anxious with it.
Yeah, that happened.
I don't remember getting laughing gas.
The nitrous just makes you not care. Well, it's supposed to make you not care. But sometimes it's maybe for you it's that like where you don't have control.
Yeah.
So that freaks you out.
Okay, yeah,
that's a thing.
You hit it right on the dot. Mm-hmm. Like that's exactly what it is. Like the fact that I don't have control of what's going on scares me. And that's what I tell people. That's why I have anxiety, because I fear that I can't control the outcome of things. Yeah. Anything. Right. So yeah, I feel you hit it right on the money right there. You got up and left. Oh. Okay, well she remembers. So can you explain to people what laughing gas is?
So the laughing gas is just nitrous oxide, and you just inhale it, and it just kind of makes your I don't care come out. Like you don't care. It relaxes you. It's not supposed to make you go to sleep, but you're kind of in that like in between of awake and asleep.
Okay, but it doesn't make you laugh either.
No, it doesn't make you laugh either. It's not like, the videos where people, I don't know where that came from, but the videos of people coming out of like general anesthesia after getting their wisdom teeth and they're talking crazy and stuff like that. Nitrous does not do that. And you can drive home after having nitrous because you just breathe oxygen for a few minutes and then you are back to normal. The nitrous is out of you and you're good.
All right, awesome. Let's go to the next question, which is, what are some common misconceptions about dental health that you often encounter?
I think the biggest one, I think sometimes, at least clinically in my office, are patients that come in for the first time and maybe they've been seeing a dentist and a hygienist for 6 years and they moved and they haven't seen anybody for a couple of years. And then they're seeing me and I'm doing all of my assessments and the x-rays and all of that stuff. And then I have to tell them, hey, you have periodontal disease. And they're like, no, I don't. I just want a regular cleaning. That's what I've always had in the past. I think that's the most common misconception is where, oh no, I'm healthy. I don't need any of that.
Whoa, that sounds serious though. What exactly is what did you say?
Periodontal disease.
What is that?
Yeah, it's where you have bone loss in your jaw, like your maxillary, your mandible. That's happening. So you have, bone where your teeth sit in the bone. Mm-hmm. And then if you haven't had a cleaning in a while, sometimes you get bacteria. Well, you get bacteria up underneath your gums, and if it's not disrupted, it starts to calcify, and it looks like little barnacles on your teeth.
Yeah.
And then your body doesn't know. It wants to fight the bacteria, but it can't differentiate between the bacteria and your bone, so it also attacks your bone.
Oh no!
And so your bone starts to recede.
Oh my God. See, now I keep thinking to myself, what if I have that? But my wife is over here saying you have that. So I don't know if she's playing with me.
Oh, that's your
I don't
wife.
know. Yeah, that's my wife, by the way. I'm sorry. Let me introduce you to my wife. Yeah.
Hi, wife.
Yeah, so I don't know if she's playing around with me or she's just teasing me, but what if I have that? Like, I'm asking myself right now, like, wow, what if I go to the dentist and I find this out about me, and that's gonna cause more anxiety because I think I'm gonna die, and all that stuff.
Well, you won't die, but I mean, the earlier you catch it, the better it is for you.
You're right.
If you just leave it alone and let it go, it's only going to progressively get worse. Unfortunately.
You make a good point right there. I'm telling you, I think I'm gonna actually meet you in person.
I think so.
How often should I be visiting the dentist for checkups?
When was the last time that you saw Lee?
I should have rephrased that question a little bit better. How often should someone be visiting the dentist for checkups?
The normal answer is twice a year.
Twice a year?
Mm-hmm.
Okay.
That was shock. You had shock in your voice.
I'm long overdue.
Twice a year. Huh? But if you have periodontal disease, depending on the severity of your disease, it can be every 3 months, every 4 months, or every 6 months. It just depends.
By actually keeping up with the dental work, will it actually go away, or are you just I guess
periodontal disease? No,
it's just something
you
that
can't regrow this bone.
Oh,
like if you break your arm, you can regrow that bone, but you can't regrow this bone. So you can stabilize it to kind of pump the brakes on it a little bit, but it doesn't go away.
Okay, so Lee over here is like putting me on the spot.
She's calling you out. She is.
Yeah, she said he should have been every 3 months, but okay, let me see what he misunderstood. He thought he said every 3 years. That's still bad.
I mean, I see it every day.
Oh God.
It's hard though, because I mean, as an adult, you get going with life, and then the next thing you know, 2 years has gone by.
Mm-hmm. Yeah. True. Yeah, I'll blame the kids. But okay, so every 3 months, depending on. So it's just something. Okay, say if I do have I can't say that. I'm so sorry.
Periodontal disease.
Yeah, that one.
Just say perio.
Perio disease. Okay. Yeah, say I do have that. So I have to, like, in order to just stabilize it, I have to go every 3 months for the rest of my life?
Maybe. You may be able to stabilize it and do really well at home care and stretch it out to 6 months. The recommendation is every 3, because most of the time patients don't do really well at home, don't stick to what they're supposed to do. And
I got you. Are there natural means of getting that's a good question. Are there natural means of getting our teeth white?
I don't know if there's natural. I know there's a lot of things on the internet, like on TikTok and different like, what do you call them, like buzz products, I guess. Hydrogen peroxide is what's going to make your teeth white. But that doesn't mean go brush with hydrogen peroxide, because you can cause all kinds of other stuff happening if you put too much hydrogen peroxide in your mouth at a time. Okay.
I thought you meant like rinse with it, like.
Yeah, people do that. I mean, you can swish with hydrogen peroxide. Yeah. It doesn't taste good, but you can do it. You can do a half water, half hydrogen peroxide. My light's freaking out. But I will say that if you use it too often, and if you're taking other medications, you can cause what's called black hairy tongue. Whoa, and it's like a chemical reaction with your body and the hydrogen peroxide, and it will turn your tongue black or dark and make it look like it's hairy.
What?
Yeah.
Oh, I want to Google that right now. What is it called?
Black hairy tongue.
Hold on. Oh, I want to see this.
But there's different things, like at home to get your teeth white. You can do, there's different toothpastes. You can do whitening strips. But a lot of those are just going to kind of brighten it up for a little bit of a time.
Do the whitening strips actually work?
Yeah, if you use them.
Oh God. Oh my God, I'm gonna share this with everybody. This looks horrible. Hold on. What?
I think I've only seen it like a couple of times.
Oh God, I went the wrong one. Are you seeing a Bing?
Yeah, I saw a Bing.
Okay, sorry. I shared the wrong one. Where is this at? Oh yeah, this one. Oh my goodness. This?
Yeah.
Yo, this looks so nasty. This actually looks like there's hair.
Yeah, it does.
Oh, that's horrible.
Yeah, so don't use hydrogen peroxide every day, all the time, and don't use it with certain medications. I can't remember what they are.
Oh, that looks horrible.
But yeah, that happens.
Oh, stop sharing. So whitening strips, do they actually work? I'm sorry, I didn't hear that part.
Yeah, no, they do. It just depends on how often you use them, and what kind you're using. If you're using something that's all natural that only has like essential oils and stuff like that, chances are it's not really going to whiten your teeth. But if you have something that's got a hydrogen peroxide or a carbine, I forgot what that is. Peroxide, that'll have it in there too.
Oh, okay. What about the what's it called? Like that toothpaste?
Don't say it.
Which one? You know what I'm talking
about? The purple toothpaste?
Well, I was gonna say that black toothpaste.
That's charcoal.
Yeah. Is that one good?
That'll work because it's abrasive. So it's like an abrasive toothpaste. That will help take stain away. It won't necessarily whiten your teeth.
Oh, so you still have.
And I think a lot of patients, I think if they just come in and get their teeth cleaned, that will be a difference and be like, oh, my teeth are white. You just need a cleaning. Sometimes it's just that plaque that's hardened and it's like a coat on your teeth.
Oh God, I definitely need to see you. What toothpaste do you recommend? That's a good question.
That's a good question. It depends on what you're looking for. Like if you are having sensitivity, you need something with like potassium nitrate in the toothpaste. So Sensodyne is a good toothpaste. The ingredients get into the little dentin tubules that you have in your teeth, and it kind of occludes those tubules, which is what's causing you the sensitivity. The only bad thing about it is once you stop using the toothpaste, those ingredients wear off, and then you'll have the sensitivity again.
Oh, okay.
So you have to continue.
So it's just temporary then.
Yeah. If you like funky flavors, there's a toothpaste called High Smile, and they've got like Biscoff cookie, coconut, watermelon, and they I think theirs has hydroxyapatite, which is like a fluoride that helps remineralize. That's a good toothpaste. I'm a fan of whatever toothpaste my patients want to use. Because if it's going to encourage them to brush.
Yeah. Oh,
I'm a fan.
I get you. Yeah, absolutely. My cousin's asking a question. How do I get my wife not to brush so hard?
Get her an electric toothbrush that has a sensor on it. They have sensors on them, and they'll like light up. And if she's sitting there pushing on it, it'll just blink at her.
I have that toothbrush, so that's funny that he mentions that, because I used to brush so hard with the simple toothbrush.
Manual brush,
but yeah. Now that I have the electric one, it gives me like the red light when I'm brushing too hard. I'm like, bro, I do what I want. No, but it's annoying when I get that red light, so I have to like slow it down, I guess. But that's.
And make sure she's using like soft bristled toothbrushes. You don't have to scrub your teeth to make them clean. Think of your teeth like the most bougie food cookware that you have. Are you going to sit there and scrub it with like an SOS pad? And no, you're going to be very gentle and clean it. Same thing with your teeth. You don't have to scrub.
Is the purple toothpaste bad?
So it's not bad. It just doesn't work. And I'm so mad at Colgate for jumping on the bandwagon. All they're doing is trying to take your money for that, because it's not. It doesn't work. The whole idea is like when you have blonde hair, you use purple shampoo to kind of tone your blonde.
Yeah.
So your teeth are kind of a blonde color. So if you put the purple on there, it's supposed to make it look brighter. But as soon as the purple is off your teeth are the same color.
Okay, so that makes a lot of sense. It's just a brand. You're
It
basically
is.
buying the brand.
Yes, it's the soft
Soft
bristles.
bristles.
Yes, that's all you really need. You don't need anything.
Nothing harder. James, Jaime, I have the same issue with Ricky. Not no more.
Oh,
Ever
you
since
brush hard.
that electric toothbrush, I'm telling you, changed my life.
It'll tell on you.
Yeah, it really would. It stopped me. It definitely stopped me in my tracks. Like, hey, slow down.
Yep.
Okay. It made my toothbrush last a lot longer than I expected, for sure.
Oh, I bet.
What are the most common dental issues that you see in your patients?
Bleeding gums.
I agree with
All
that.
day. All day, every day. Some days are more bloody than others.
I'm not the only one there.
Like today was a bloody day. Today was a bloody day. It was just blood everywhere.
Murder scene. Can you explain the process of cleaning and what it entails?
Oh, like what happens when you come to the hygienist?
Yes.
You see the hygienist? As a new patient, we do x-rays. It's like a panoramic x-ray, just the full mouth. And then we take a full series of individual x-rays. And then I do a periodontal assessment, which is like where we measure the gums.
Oh, I hate that.
Mm-hmm.
Don't you guys call it like the pockets or something like that?
Yes, yeah, periodontal pockets. Yeah, look at you. And then we take images. I'll do a scan, and then the doctor does the exam, and then all of that information decides what type of cleaning is needed.
Needs to be done. Okay.
Mm-hmm. So if you have areas of bone loss, if you've got a lot of buildup, and you've got buildup up underneath your gums causing bone loss, and you have a lot of bleeding, then I'm going to recommend laser treatment, deep cleaning, and then we'll look at your frequencies.
Well, what is the laser treatment?
I just
what
blew
is
your
that?
mind. I use a laser, and it decontaminates, and it helps heal. Helps with healing. Yeah.
I don't think I've ever heard of that one.
Yeah, it's something new, but not like super new, I guess. I heard it's bad to use mouthwash.
I heard it's bad to use mouthwash from other dentists. Is that true? Is it?
I don't know what that. Like the dentist gives you the mouthwash?
I think he's saying that the dentist told him that.
Oh.
The mouthwash.
I think I know what he's talking about. So I know there's videos, I've seen some of them too, going around that mouthwash is bad because it kills bacteria, and a lot of people are saying that it kills all the bacteria in your mouth, and it's supposed to be like a happy biome. You're supposed to have good bacteria, bad bacteria.
Bad bacteria?
So if you kill everything, then that's not good either. Unless you are like drinking this mouthwash and using it all the time, then yes, that might be harmful for you. But if you use it in moderation, like once a day, every other day, you're just trying to keep the bacterial load down. So if there's not a lot of bacteria in your mouth, there's not a lot of bacteria to make plaque, which causes the inflammation and the bleeding, the whole thing.
Okay. See, I didn't even know about that. That's awesome. Oh, your husband said, explain when a patient says, I just want a basic cleaning.
So there's this thing in America called dental insurance that is the bane of my existence. It's not insurance. It's more like a discount plan. And patients get their dental insurance and they're like, okay, it says I can have 2 cleanings per year. I can have this. They'll pay for this and it'll be free. And then they come see me and I have to explain to them that they have periodontal disease and insurance does not pay for perio cleanings. No. They'll cover some of it, like you'll get a discount, but it will not be at 100%.
I think you should definitely tell the patients that as soon as they walk in. By the way, your insurance is basically a discount card.
Yeah, it doesn't matter. And then they'll tell me, okay, well, cool. I'm glad you did all of that stuff and you've explained everything to me, but I just want the regular cleaning.
Oh God,
I can't do that. It's like going to the medical doctor and saying, them telling you, okay, you have diabetes and heart disease. and then you're like, I
Cool,
don't
just give me
think
a shot.
so. Yeah, I don't want to take any of that medication. I just want something for allergies.
Wow.
They can't do that.
A dentist
Yeah,
said it
see,
was bad to use mouthwash.
I've heard that too. I haven't read enough like scientific data, peer review type things to have a definite yes or no on that.
Mm-hmm.
But from what I learned in school, oh yeah, we have care credit. What I learned in school, mouthwash is not bad. It's just moderation. You can't overdo it.
Can't do it too often, actually.
Yeah. We have care credit in my office. We take it.
Awesome. See, I was gonna ask something, but it left me. Let's go to the next question. Are there any new kind of the same thing that I asked you earlier? Are there any new advancements in dental technology that you find exciting?
We just started doing AI with X-rays.
Whoa!
So the artificial intelligence stuff. So we take the X-rays, and then we have an AI program that reads it, and it'll tell us like, hey, look at this little area on this tooth. That looks like something might be happening. Or it'll measure the bone loss on the X-rays, and it'll color code it. So if it's like red, then it's like, you need to look at this. There's a lot of bone loss here. It's all just like letting us see things that maybe we didn't see before. It's not taking over any kind of diagnosing. It's just saying, hey, look what we found.
Okay. Oh, that makes sense. Let me see if I can find something on your Instagram that we could probably show. Do you have that?
I think I talk about like we're just starting it. I don't think I've made a full
video
like,
of it.
This is what it looks like. Yeah.
Any technology you want to talk about on there? Let me see.
On Instagram? What do I have
Yeah.
there? I love my centipede suction.
Yeah,
but
that's what I'm trying to see.
That's like technology for me. It's not really.
It's not.
It's just for me. It's for hygiene. Like a hygienist would be excited for it, but patients just kind of look at like, what is this?
Let me see. Is that the Miracle Smile that I saw thing?
No, but that's a water flosser that I've tried, and it actually surprised me.
I was just about to ask you that. How good are those things? Or do they actually work?
It was like $40. Again, if you're going to use it, it's going to be better than you not using something. You know what I mean?
Yeah. Because I thought those were pretty cool. But
I would use it.
You would?
Yeah.
Like, what about for people with sensitive teeth?
I don't think it would bother you.
No?
I mean, like the cool water, you could warm your water up and put the warm water in there.
Oh,
and use it
that's true. I didn't think about that. Okay.
You could even put a little bit of not peroxide, mouthwash in there, and use it too.
That's smart.
But it's kind of like how much do you want to invest? Do you want to invest and go full tilt and get the most expensive water pick, or are you kind of like, I may or may not use this, and $40 is going to be good for me? Then
I think $40 is pretty. It's a pretty good investment.
Then
what is your favorite thing to do? What do you mean, Jane? What do you mean, Jaime? Do you know what he means?
I know what my favorite thing to do is when I'm doing deep cleanings on the patients that have periodontal disease. When they have a lot of buildup and they're bleeding a lot, it's just, that's my favorite thing.
I think I saw.
I probably did.
Something. Yeah.
The one with the X-ray. I think I posted it yesterday. Yeah. No. Every hygienist is like, yes. When we see that on the X-ray, we get really excited. It's kind of like the pimple popper videos.
Yes, those are pretty.
Yeah,
those are pretty. Let me show.
What nobody says. It's very gorgeous to me.
Yeah, you see those little like thorns on the teeth. Yes, that's calculus. Yeah.
Hear ye, hear ye.
See those little points? That's the buildup. And you see how the bone kind of scoops up?
Oh, wow. Yeah.
That's bone loss. That's what's
causing
all the drama.
See, I was trying to find that picture.
It's just a. You can see it right there. Yeah.
Yeah, you can see it right there. All that. So basically, cleaning all this stuff is what really like
That's my
gives you
job.
that funny feeling of like, oh my god,
Yeah.
this is so satisfying.
That's why I get up in the morning. But see, you see it above where the stuff is gone.
Yeah.
And it's really red. It looks really irritated.
Oh, yeah, it
So
looks
what's
bad.
cool for me, of course, doing it and getting it all up is just awesome. But I know what it's going to look like after when it starts to heal and how much better it's going to be for the patient. And that is, I love my job.
Oh, hold on. Wow, my screen went really low. Is Invisalign braces needed?
It depends. I see a lot of adult patients that could use Invisalign or Invisalign or braces, especially if you're having a hard time keeping your teeth clean because your teeth are out of alignment. It's really hard to keep everything clean. So if you have ortho and you have everything straight, then it'll be super easier for you to keep clean.
Okay, makes sense. Hold on. Yes. What is her favorite? Oh yeah. Wait. Her favorite thing to do, like for me, is adjusting in notes and documents.
Oh yeah, no, I don't like to do notes. I don't like. Yes,
That's what you call
Lee gets it. She knows.
Orgasm.
Like we're just sitting there going, yes.
Oh my god, yes.
Hey, maybe we can record it.
Why is she on here? She's
Sorry.
just gonna slam me the whole time.
I mean, she's got good ideas.
I guess, right? But for those 7 viewers that are currently watching, go ahead and share this live as much as you can. You're gonna see people bashing me right now, and it's all good. It's all fun right now. But yeah, go ahead and share this live as much as you can. I see you watching. 8 viewers now, currently watching. So go ahead and share this video as much as you possibly can. Get those views up. Where trying to find the question that I was at. Oh, here I am. Next question is, how can we prevent bad breath?
Brushing and flossing your teeth.
There you go. Plain as
It's just bacteria. You know what bacteria does? So it takes the stuff that you eat, it metabolizes it, and basically poops acid. And that acid creates the plaque matrix, and that is what stinks.
That's a pretty good way to see it. Next podcast, we will do a live with Ricky getting a deep clean.
Done.
Wow. You guys are talking so much about me right now, but you can't
ask them questions. You can't ask them like, when was the last time you got your teeth cleaned?
That's exactly what I was just thinking.
Like, that was last week.
What are the best practices for brushing and flossing every day?
Yeah, every day. And brushing and making sure that you're not just like, and then you're done. You really take 2 minutes, angling your toothbrush towards the gums, so you can get like, right where the gums are, the gum line, keeping that clean, and just taking your time and making sure that you're going around the tooth and not just kind of everywhere and missing stuff. Being methodic. Can I say?
Hey, she still has her assistant license, so.
Hey, that is good to know.
Let me see, where am I? What is it? Oh yeah, you already answered this one, right? Yeah. What are the effects of smoking on oral health? Oh, that's a good one.
Yes. Yeah, there are effects. So when you smoke, all of your blood vessels like shrink up and they're not flowing like normal. So that in the mouth, you can definitely see that. You're not going to bleed as much, but your tissue is going to be real tight, and it depends on how long you've smoked. It can keratinize, and that's not good. It can cause the bone loss to happen at a rapid rate, staining, and if you're like smoking weed, or if you're a vape, you're thirsty all the time because your mouth is dry. And if your mouth is dry, you don't have the salivary flow that is going normally. And then your plaque will build up quicker because you don't have anything to flush it out.
Oh, okay.
Same thing with smoking.
She's going to need to... Dang! Lee too?
Lee will come down.
Leo, that's the only thing that brings her down is when I'm getting a cleaning. Thoughts
What
on
is
Zen?
I don't know what that is.
You don't know what that is? What is that? Let's look it up. But what is Zen?
No. Oh, the nicotine pouches.
Oh yeah, nicotine pouches. Yeah, that's what it is.
Is there nicotine in the pouch, or is it to help you quit smoking? I think it's a tobacco free. If it's to help you quit smoking, I'm a fan of it. Smoking's bad. I smoked in the past. I smoked for a year, and I swear it took like 2 years for me to quit.
Mm-hmm.
My husband dipped for a long time, and he finally quit. So I get it.
I think she means like the don't the nicotine
like to hold
patches
them?
like yeah.
If
Like,
you, I mean, they can cause irritation.
But,
but if you're dipping, it's gonna be worse if you're dipping with the nicotine. That's gonna be more harmful.
Oh, okay. I guess that's what she meant. Show her a pic of it, please. She found it. She knows exactly what you're talking about.
Zen?
Yeah, it is. Yeah, it's definitely that.
Yeah, and they're like peppermint and spearmint.
Why did my teeth feel like they were falling out and brittle during pregnancy? Ooh.
So the thing with when you're pregnant, you are building a human, basically, right? So everything else kind of goes to the wayside. You may not have been brushing like you normally did. You may have been eating different than you were before. All those kind of things can cause cavities. The falling out brittle, that could just be stress. Because I know my sister would have dreams that her teeth were falling out, but that's because she was really stressed out. The brittle feeling, it could also be if you had any kind of buildup that you couldn't see, and if it's falling off because it got hit or whatever, that can feel brittle.
She said yes. The dreams.
The dreams, yeah.
I still have dreams of my teeth
probably
falling out.
Stress.
I have dreams of my teeth falling out, but I think that may be like a like
silent
future
killer.
approaching.
No.
I'm playing. Oof, stress is a silent killer. Yes, it definitely is.
Yes.
Where was I? How does diet affect our teeth and gums?
That's a good question. So the more carb, sugar load type foods that you eat, that is what the bacteria need to do their thing and make the plaque. Mm-hmm. So if you starve them and you're not eating as much of that kind of stuff, then there's not as much for them to make the plaque. Like patients that are on like a keto diet, clean.
Really?
Yeah. It's a big difference. Big difference. So less bleeding.
What do I need the dentist for? I'm playing.
I've heard that also.
Really?
Yeah.
I'm on keto. Why go to the dentist?
Yeah.
That's funny. I would have never guessed. What's the most memorable client that you think that you can think of and remember? You're taking all my good questions, Jaime.
Did he see these questions that you wrote?
No.
I was trying to think of this when I read it too. I don't know. I really like the ones that come in and they're I mean, they're kind of like you were. You're like, my teeth are bombed. I hate this. I've never done this. You know, it's going to be so bad. And then like the next year after we've done the cleaning and they're doing better at home, they just smile more and they're like, hey, I feel so much better about my smile, about my teeth. Like those are really cool to me.
Really compliment? Do people compliment?
Yeah.
Like, oh my god. Yeah, no,
yeah.
I'm pretty sure you live for that.
Or the ones that are like, oh, I've been to the dentist. I hate the dentist. I hate coming here. And I'm like, you know what? Me too. It's 7:30 in the morning. I don't want to be here. But then they just keep coming back, and I've seen them for years.
And you think to yourself, like, maybe I had an impact on that.
Yeah. I mean, I'd like to think so, because otherwise they would go to another office, right?
Exactly. What's your Jaime? Seriously, what's your why? Why do you do what you do?
I love the one-on-one patient interaction that I can get when they're in my chair. Going back to like what I thought I was going to do after retail, I thought for a hot second to be a nurse, and then I thought of all the things that nurses do. It's like, no, I can't do that.
You can't do
Props
nurse?
to them. No.
What?
I can deal with all of this blood, all the stuff in the mouth. Anything else, I'm out. So I really, really love the one-on-one, because I have patients like during COVID or right after COVID, I have patients that come in and they're like completely different. They were put together, shirt tucked in, clothes looking good, and then the next time I see them, they're like bummed out. They've got like a ratty t-shirt and some flip-flops on. I'm like, hey man, how's it going? And I can actually talk to my patients because I have that one-on-one time.
Yeah, for sure.
You check in on their mental health and, make sure that they're doing okay. And it's not just next patient.
Gotcha. So the conversation's really there. Jaime,
Yes.
who's
No.
hosting this show, man?
I don't know.
Do you miss
I feel like his name needs to be somewhere on here.
No, right?
No, I do not miss school. And every Monday when I am at hygiene school as a faculty member and I see the students, I'm like, oh, it's going to be okay. I know it sucks right now, but it's going to be okay. No, I don't miss school. I miss Lee. I miss Lee and her shenanigans in school.
Lee's fun.
But
Lee's
no.
a funny person.
Yeah.
Believe it or not, she had me dying laughing sometimes whenever she would come over. He got great questions. Yes, he certainly does. Excuse me if I can't read these questions. These words are so
They're
small,
like itty-bitty.
especially. Yeah, they're so little, so I'm constantly like squinting. Yeah, Belen said I miss her. We all miss Lee, guys. Sorry if I'm yawning, guys. I'm just a natural yawner.
No, you keep
that's
talking
even
about yawning. I'm going to yawn.
If that's even a word. Can you explain the importance of fluoride in dental care?
Yeah, this is a hot topic.
Really?
This
Go ahead.
is like a controversial topic. Fluoride. So the whole point of fluoride, like you get fluoride in the things that you eat, like bananas and whatever. But when you get fluoride in your toothpaste or when you have a fluoride treatment done at the dentist, it's a different level of fluoride. And that fluoride helps remineralize any weak spots in the enamel.
Okay.
So if you've got areas that are starting to get weak, that fluoride just remineralizes them. But once those weak spots break, it's a cavity and there's no going back.
What? Okay.
Yeah. So there's a lot of people that are like, fluoride is bad.
Yes.
It can cause like different brain issues. There's not really any scientific studies that are saying that, unless it's in mass quantities. So unless you're like eating toothpaste a lot, you're good.
That's what I was told too. Somebody said unless you're absolutely
like just
doing something
chugging
you're
it.
supposed to. Yeah.
Yes.
Yeah.
There is a new alternative, I guess, to fluoride, or a couple of different ones. It's hydroxyapatite. There's some toothpaste that have that in it, and it's the same. It does the same thing. It's just not the fluoride.
Okay.
Yeah, and then there's oh no, go ahead.
No, go ahead. Yeah, stay in the topic.
There's a treatment that I can do in office. It's called Curodont, and it can actually remineralize the very, very initial stages of a cavity. So it's a cavity, and I can see it on the X-ray. It's just very, very small. Maybe it's not big enough that we would normally do a filling, but we can place this Curodont there, and it can heal it.
Really?
That's
like right there and then.
Yeah, it takes like over 6 months. It strengthens that area.
Okay,
really cool.
That's pretty interesting.
But you can't get it over the counter. You would have to get it like at the dentist's office.
Hey, that's a good marketing right there. Can't get it anywhere else. You have to go to the dentist for sure. Jaime, of course. If you had to choose a different profession, what would you choose? As a
Oh my
chiropractor,
God.
interior designer, sales, etc. Well, she did sales.
No.
So.
Yeah, I did retail. I don't want anything to do with that ever. Education, like that's where I'm going to end up.
Really? You're gonna teach?
Education, Yeah,
Okay.
yeah, I'll teach.
Are you gonna teach dental hygiene?
Yeah.
Okay.
Right now, I'm just in clinic. I'm just one of the clinic professors that helps with the students when they're seeing patients.
Uh-huh.
And I love that. But eventually, I'll teach
You
full
move.
time.
Okay.
Not right now. I like clinic too much. I don't know if I would do another. I don't want to do another profession. I don't want to start over.
You're done. You're done.
I'm too
This is
old
it?
for that. Yeah.
But are we really too old to do anything? Really?
No, but I don't want to. I like my job. Oh,
Who's gonna
that's not nice.
Why is she gonna
hate
teach
math.
algebra?
Oh, you don't want me teaching algebra or any math for that matter.
Let's
No.
see you teach, Belen.
Mm-mm.
Let's see. There was actually a pretty interesting video that I saw on your Instagram, and it said 5 things I wish I knew before becoming a dental hygienist. What are those 5 things?
Look, I know I made that video, but I don't remember.
You don't remember? You want me to go ahead and pull it up?
Yeah.
Okay, hold on. Let me pause it. There we go.
I'm not like, what did I do?
I'm still on your Instagram. Yeah. Imagine if that wasn't even yours.
That would be funny.
There we go.
Oh.
Oh crap.
Yeah, you have to hit more. What were the 5? Oh, yeah.
Oh, I have to read the caption.
That dental insurance would be such a big part of how patients respond to treatment.
Oh, okay, yeah, because of what you
Huge.
mentioned before.
Yes, and how physically demanding this job would be.
Really?
How mentally draining the day-to-day is. How some dental offices are run like a business and not healthcare providers. And that the association would be struggling because hygienists don't see that. Oh yeah, see, look, that was a good one. Those.
Gotcha. But you're seeing all the good the positive things out that are coming out of there. Let me remove this. Fortunately, whenever I share a video, the words become even smaller.
Oh yeah.
So I have to stop. Yeah. You can have your daily teachers. Oh God.
No, I don't want it. I had to take college algebra, and I thought that class was going to kill me, and I don't ever have to take algebra again. So,
You never wanted
no.
to teach.
Mm-mm. Ask me how many times I've used algebra in my adult life.
How many times? At all?
0. No.
Really? You don't? Oh,
No,
man.
I'm not using algebra.
I would love to. I would love to do that then.
Ugh.
I was being sarcastic. LOL. Like you asked her if she would teach hygiene. I'm pretty sure she would teach in the same field.
Oh, when you were
Shut up,
asking
Billy.
if I would teach
Yeah,
it.
she's being sarcastic. Shut up, Billy. Oh, this is a good question. What are some signs that indicate a dental emergency?
Pain.
Mhm.
If you're in pain, you are already past the point. I don't want to say past the point of no return, but most time when you start to feel pain is when you start getting into the more expensive treatment, because the nerve is involved.
Oh.
If you start to swell, that's a dental emergency. If you start to see pus or any kind of like pimple, that's a dental emergency.
What are the most common painful, like, I guess, things that people go for? Like,
The abscesses, the pimples, mostly that's the one that causes people the most pain because you have an infection.
oh my God, and what is the treatment for that?
What would treatment be? A root canal?
Oh, and I heard that's painful. I personally have never had one, but I heard it's painful.
Oh, I've had them.
You've had one?
I mean, yeah. I've had pretty much almost everything done. I haven't had an implant yet. I have a tooth that needs an implant, but I haven't had one yet.
Oh my God.
They're not. I mean, they're not painful. They're long. It's a long appointment, but it gets you out of pain.
Oh, okay. Would you say Were you in pain before you went in?
Yes.
How
Yeah.
bad was the pain? 1 through 10.
I mean, I've had children, so
That
6,
worse than that?
maybe not even no.
Oh, okay,
No,
I was about to say.
No. Like a 4. It's enough to where it can cause you to, like, you can't eat correctly because it hurts, and if it starts to swell, it's not a good time.
That sounds painful. See, so a root canal would definitely be needed for some an emergency situation like that.
Mm-hmm.
Most
and
of the
then,
time,
unfortunately, oh no, go ahead.
I was gonna say that most of the time, will that be the case? Will that be like the treatment?
Sometimes it depends. So going back to the whole insurance discount plan thing, root canals and crowns are expensive. Even with insurance, they're expensive. Yeah. So sometimes patients are like, you know what? I don't want the tooth anymore. Just take the tooth out. Yeah.
But wouldn't that cause even more pain?
No.
Really? Mm-mm. So I'm starting to realize, back to me again, that you may be telling me something that I may not want to hear, but I'm noticing that my back teeth, the molars, right? I don't know. I'm not too sure what they're called.
Yeah, they're in the back.
Yeah, so they're pushing my teeth on the side.
Mm-hmm. Do you have your wisdom teeth?
Yeah.
Oh. Yeah.
So I mean, I'm not in any pain.
Right now.
But hold on. But would I need to get that removed in order
wisdom teeth?
Yeah.
They gotta go.
Okay.
I hate wisdom teeth. Nobody needs them.
So yeah.
Yeah. Those are gonna cause more drama than anything. I didn't get mine out until I was in my 20s. I don't remember. It wasn't that long ago. And I ended up losing a tooth in front of one of my wisdom teeth because it came in like this.
Yeah.
Like here's instead of like this, it came in like this.
Yeah.
And it ended up damaging that other molar, and so I lost both of them on this side.
Jeez.
I did make an A in that algebra class.
What is the recovery time on that though?
It depends. It was like a weekend, and my husband at the time, or he wasn't my husband then, but he was like a nurse. It was like the best vacation, 3-day vacation that I had at that time because the kids were young and they were with my parents, and he was on a timer. It was like, flip over, take this medication, eat this popsicle. It wasn't bad.
Oh, okay. So yeah, you were good then.
Yeah.
So like my wife said, he needs those removed, but he's too scared. I'm a big baby.
It's all right. They've got medication for that. I had to take it whenever I had mine. I had to take I don't remember what anxiety pill I took. I took one when I got there, and then I think they gave me an Ambien to put me to sleep before they put me to sleep.
Oh, yeah, no. They put you to sleep?
Mm-hmm.
Oh, heck no.
Mm-hmm. No, straight night. You don't remember anything.
See, that's what I'm scared of. I don't want to be put to sleep. I don't know. Like I mentioned to you before, I want to be in control of my body. I want to know what they're doing.
You don't want to be in control of that. I promise. Just let it go.
Let it happen.
Go to sleep. Yeah, let it happen. Go to sleep and wake up, and you'll be fine. You'll take the other medication. No, don't freak out. You'll be fine.
So Jaime said I had to eat mashed potatoes for 2 days, but it wasn't too painful.
Yeah.
Only if I chew hard on. Oh my god. That's almost like being on a diet you didn't ask for. He told the dentist that she can remove them with
No, you want to be numb.
Really?
And sometimes they have to like cut them out.
Oh, yeah, I did hear about that. Yeah.
No,
I did hear that
cutting. Yeah. Yeah. No,
yeah.
You don't want to do that without being numb. Don't do it.
I am terrified. Are there any natural remedies for toothaches or gum pain? For those people who don't want to go to the dentist.
Yeah, I mean, any remedy that you're gonna find is only gonna be like a Band-Aid. It's only gonna fix it for just a little bit. Yeah, it's not gonna get rid of whatever it is that's causing the pain. Toothache. Sometimes you can use, I think it's cloves, and you can kind of pack in there, and it'll help numb it for a little bit. There's Oragel, but again, you can't take mass quantities of it because then you're gonna end up you're gonna hurt yourself.
Oh, yeah, for sure. Yo, I think he meant cheeks were so numb for a couple of hours after.
Yeah.
What's the oldest person you saw getting their wisdom teeth removed? I want to know that too, actually.
I mean, we've recommended people in their 40s. I mean, if the wisdom teeth are causing you problems, we're going to refer you to get them taken out.
Okay.
If you have cavities in your wisdom teeth, we're going to refer you, and you're not able to get back there and like keep them clean, we're going to refer you to get them out. Because we're not going to put fillings in those teeth because you can't keep them clean.
Yeah.
So we're just going to keep putting fillings in just get them out.
Yeah, that's true. Don't listen to my wife. His will easily come out there barely. They're strong. I could chew rocks back there if I wanted to, but
don't do that. don't chew ice.
Don't chew ice. Do I chew ice? Not really. I mean, it's a little satisfying, but I don't do it.
Don't. It's not good for your teeth.
I heard about that too. Is that really that really true?
Especially if you have like amalgam fillings, the silver fillings, because your inside of your mouth is going cold, hot, cold, hot, cold, hot. So your teeth are doing this. And when you're chewing the ice, it can cause fractures and stuff like that over time. Okay.
I mean, I'm safe now, right?
Maybe.
For those 11 viewers watching, go ahead and share this live. Hey, man, I'm learning a lot right here with her. So if this is very educational for you, go ahead and share this live. Go ahead and share this live in general, man. We're having a good time. My guy, you had no bone left. Not putting you on the spot. Maybe you would listen to her.
I feel like he's gonna be in my office pretty soon.
See, if Lee was here, I would have gone to her.
I know. It's all her fault.
Why do people shave their teeth?
I don't know. It's for aesthetics. It's for a vibe. I don't know why they do that. It drives me nuts. Yeah, they like file them into points.
What? Like a shark?
Yeah. It's so bad because you only have so much enamel on your tooth, and if you take the enamel off, your dentin is exposed, and your dentin is super, super soft. So the enamel is like the hardest bone in your body, right? So you're going to shave that off and expose the soft part of your tooth. Oh, yeah, that'll get cavities like this. It'll be sensitivity like this. It gives me the heebie-jeebies whenever I see it.
Is this actually a trend that's going on? Like people really shaving their teeth?
Yes.
Let me see this. I need to go to Google again.
I'll say you can find pictures really quick.
Let me see. What do I type? Like sharpening teeth?
Yeah, maybe. I don't know what you
see. Fangs?
Teeth. Yeah, fangs.
Oh my god. Is this really hold on. I'm about to share this this what I found.
It's gonna give me the heebie-jeebies.
Is it like this? I want to ask you.
Yes.
Like that? Really? People are actually doing this.
Well, I think that's like a tribe. Like they do that on purpose. But people in the US do it.
Yeah, I think this
maybe not to that. Maybe to that drastic, but yeah, people do that.
Like
the things.
Oh, like.
I don't think that's real. That's what's his face. Maybe. I don't know.
Well, it's something similar to that, right?
Do not recommend. Yeah.
Wow, people are actually doing this. This is insane.
It hurts.
So you see people that are. Have you seen people?
I've never seen anybody in my chair.
Okay.
No.
Okay.
But I see it online.
I need to see this online then. And veneers. What about veneers? Do you recommend?
Veneers aren't bad. They're not bad. They're expensive. People get them for like aesthetic purposes. Like 90% of the time, I have patients in my chair that want to whiten their teeth. Like, what kind of whitening can I do for them? I have to explain to them that they're not going to get that kind of outcome. Because most of the time, like movie stars and stuff like that, they have crowns, they have veneers. They're not natural teeth.
Yeah, of course.
You're not really going to get that white.
I want to go in there and be like, I want the Steve Harvey teeth, like.
Yes. You're just going to have to get work done.
Yeah, that's a lot of work.
But I think what your wife is saying is when you get veneers or when you get a crown, they do shave your tooth.
Oh, that's right.
To put the crown on,
Is
they do
now
that.
no, is that really?
Depend. Oh, is that really? Yeah. They have to because they have to take away some of the tooth to put the crown on, so it matches.
Isn't that kind of depressing though? Because I mean, your teeth are gonna look like that for the rest of their life. Though, what would that come off and like your teeth are exposed?
Well, yeah, you would just have to get another crown put on.
Yeah, I don't know about that either.
But most of the time, people get crowns because their tooth is too broken down. So you're not ever going to be like, I have a healthy tooth, make that a crown. Okay. Normally, there's something wrong with the tooth that you're needing the crown to keep the structure, the base, so it doesn't break and go away.
Jaime is asking, don't you have to get veneers done every 10 years or something like that?
I think crowns and veneers have like a life expectancy of about 10 years, but it depends on how well you keep them clean, and how you treat the crowns and veneers. I've had crowns, I swear I have a couple that are older than 10 years.
Oh wow, they're still good.
Yeah.
Oh, that's good.
So it just depends.
Can you explain the connection between oral health and overall health?
So this is a joke, but medical insurance and like doctors and stuff like that, a lot of people think, well, dental is separate than your body. Like every other disease that goes on in your body, it's separate, but like your mouth is connected to your body. So how is that possible? You've got bacteria and stuff that's in here. So if you have a lot of bacteria in your mouth and you're bleeding, that bacteria can get into your blood. That blood can get into your body. That kind of stuff can cause diabetes. It can increase the diabetes, cardiovascular disease. It's been linked to Alzheimer's disease. All kinds of things.
So your dental health has a lot to do with your other, basically your other organs as well. That's crazy. Because I have, my wife used to tell me that too. She's all like, did you know that if you don't take care of your teeth and an infection occurs, the infection could run into your bloodstream or something like that. It can cause a heart attack and goes.
Yes.
Which I at the time I thought she was using it as a scare tactic, but at the same time I'm like, I think she may be right.
Yeah, there was a football player recently that passed away because of dental infection.
Really?
Yeah. I can't remember what his name was.
Something so almost something so simple, right?
Yeah. Let's see if I can find it.
Oh, if you find it, let me know. That way I can look them up too.
I guess it was a while back.
Was his name Mark Williams? Mike Williams? I'm sorry.
That sounds familiar. Was that recent?
Yeah. It was back in December 24th of last year. Of course, 2023. Former NFL player Mike Williams died of dental-related sepsis.
Yeah.
Wow, at age 36, medical examiner
bacterial sepsis.
Yeah, bacterial sepsis. What exactly is that?
An infection. So if you have cavities, sometimes they all get so bad that it can cause an infection, like in your jaw. And there's so much going on right here. If any kind of infection gets going, it can move really, really quick.
Like throughout your body and just cause something catastrophic.
Yep.
Mouth and skin is the first line of defense.
Well said.
And tears. That's what he said.
And tears. And blood.
And blood.
In your mouth, it flushes stuff out.
Well, that is a good way to look at it. What are the benefits of dental sealants?
I recommend dental sealants because your like the chewing surfaces of your big molars are really groovy, and the sealant material just fills in the grooves, and it makes it easier to keep clean. When they're real groovy like that, bacteria can get in there, and when you brush, you can't really clean it out because they're very, very fine. So the sealants just kind of fill in all of that, so it's easier to keep clean.
Gotcha. But like I said, I've been neglecting my teeth. I have to get back on track. I have no insurance at the moment. Does your office have a discount plan for those that don't have insurance?
We have an in-house discount where it's like 30% off. I think it's $99 a year, and then you get 30% off of whatever treatment. But if you are looking for a cleaning, Lone Star College Kingwood has a dental hygiene program, and they are always needing patients.
Oh, really?
Mm-hmm.
Huh. How much do you
pay? It's a process. It's way cheaper. I can't remember, but it's way cheaper than you're going to find at any office.
Would you recommend it?
Yes. As a former hygiene student and as an educator, yes. They need patients.
They need patients.
It is a process though, because you have to get screened, and then their appointments are 4 hours. They're students. They're little babies. They take forever to do everything. So it's a couple of months for you to probably go through the hole and get your whole mouth cleaned. But it's an option if you don't have insurance.
Huh. We'll definitely be looking into that then. Huh.
Yeah, if you go onto their website, you'll find it.
Lone Star Kingwood?
Mm-hmm.
Okay.
And then, of course, if you can't figure it out, you can message me.
For sure. I'm pretty sure I need mine every 3 months now.
Yeah.
Yeah, I'm going to call her out too, because she's been calling me out the whole episode, but she hasn't gone to the dentist either.
I'm just saying.
I went there.
You went to Lone Star?
Yeah. She did go to Lone Star.
Oh.
Yeah, she did go to Lone Star. I completely forgot about that.
It's in a brand new building now. Since Harvey came through and just kind of the whole
washed everything out.
Mm-hmm. Wow. So they have a brand new building. It's really nice.
Really? Mm-hmm. I haven't been over there in like a long time. I don't pass by Kingwood much. That's.
I mean, if you don't have any reason to be out here, yeah.
I really don't.
Like I don't go down Kirkendall very often.
Can you provide tips for parents on how to encourage good oral hygiene habits in children?
Repetition and not making it not making it a big deal, not making it traumatizing, I guess. I mean, the kids are going to scream when they're a certain age, anytime that they don't want to do anything that they don't want to do, but just helping them and making sure that they know, hey, you still need to brush teeth. You still need to brush your teeth. And I promise as a parent, that's the last thing that you want to be telling your kid over and over and over and over again. Yeah, they just need the reminders. And taking them to the dentist so the dentist can tell them, or the hygienist can tell them, and show them pictures and like scrape the plaque off their teeth and be like, do you see this? That's disgusting.
Yeah, we try to make it fun. We try to make it fun for the kids. You know, I don't.
There's so many different like apps and toothbrushes that hook up to apps, and yeah, there's all kinds of stuff.
I put the brushing their teeth song. This is the way we brush our teeth. Yeah. I'm over here singing it.
I love that.
I put that song because you know they start looking at it like, okay, you know, this is the way we brush our teeth, and they sing it all until like it. It goes away.
The 2 minutes is up.
Yeah, the 2 minutes is up, and you know,
Sweet.
of course, you know, next thing you know, they're done brushing their teeth. Thing is, I would love to get my teeth cleaned.
No, it's a time thing. It's time. You gotta make the commitment to you to make the time, because I bet you make time for other people, but not yourself. And she's a mama. Is that a mama? I know the mamas.
Mom of 3. And that was 6.
Lord. I was like, that's a lot, but 3's a lot. 3, 6 is the same. I know. You just even if you like plan the time.
Gotta
make the time.
We just been so busy, but I think we definitely have to make the time.
I get it. I get the busy part.
What is your go-to movie genre? By good old Jaime.
Like, okay, so I don't watch TV a lot.
Mhm.
I listen to audiobooks the majority of but if I'm gonna watch TV, if I'm gonna put a show on, it's gonna be Schitt's Creek, or it's gonna be any kind of crime docu-series, murder. I want all the murders, or like Real Housewives, just
okay.
trashy reality TV.
Trashy reality shows.
Yeah.
I was gonna ask you. You say you listen to audiobooks. What kind of audiobooks do you listen to?
I listen to like sci-fi, fantasy, romance, rom-com, horror, thriller.
Okay, so pretty much
Whatever I'm in
anything.
the mood for. Yeah.
Yeah, you know what? I say that a lot too. Whatever I'm in the mood for, I'll listen to. Because sometimes, I'm a driver, so I'll listen to podcasts. I'll listen to country rock. I know it's not
Yeah.
audiobooks, but I listen to whatever
Same
music.
thing. Whatever.
Yeah, whatever you're in the mood for.
Yep.
And sometimes I do listen to audiobooks too. Like, oh my god, I think I want to listen to an audiobook.
I love it.
You already answered this because Jaime took my questions, of course. So I'm skipping a lot of them. Okay, yeah, that was another question he took.
He did take a lot of them.
He took a lot. Yeah, I think I already answered that. Well, let me ask. Can you explain the process of getting dental implants?
I like the bare basics of it. Yeah. Like I said, I've never had them done. So most of the time, like if it's something I've had done, I can tell you exactly what goes on. But so if you have a space where you're missing a tooth and you want a tooth placed there, you have to see either a periodontist or an oral surgeon. They'll take a CBT scan, like a cone beam scan, and it's like a 3D scan of that area of your mouth. So they can map out where they're going to place the implant.
Okay.
And then it is an actual screw into your bone. And then it heals. And then you go back and you get a crown placed on. And it's very, very sturdy. It's more sturdy than like a bridge. But it's very high maintenance. You can't just be like, I got an implant. I don't ever have to go to the dentist again.
Really?
The more you do to your teeth, the more high maintenance your teeth are.
And how long does it take for this? Like, I guess the screw, the healing process of that? Yeah.
It's like 6 to 8 months.
Whoa! And then
it's a
you
whole
have to go
process.
back.
Oh yeah.
God, I have to go back and put that in.
Yeah.
Jeez.
Like the painful part of it is just the initial placement.
Yeah.
There's not really any
I don't know,
painful part after that, but.
What are some tips for maintaining oral health during pregnancy? I don't know if we answered that whenever.
No, I don't. It wasn't that exact question.
Okay.
Just keeping up with your habits and making sure that you're staying on top of brushing and keeping everything nice and clean, and your eating habits. I think that's where most of the time people go wrong when we're pregnant is the eating habits, because at that time you're just trying to survive. You're just going to eat whatever your body says that you can eat without throwing up. And then throwing up is also bad for your teeth.
The acid, yeah.
Yeah. So just staying on top of it as best as you can. And you can still get your teeth cleaned when you're pregnant. You still do everything. We just don't take x-rays in your third trimester. I always forget the trimester. We just don't take x-rays unless it's like an emergency.
Oh, okay. So in any trimester, you don't take x-rays?
I can't remember if it's the first or third.
Okay.
I don't know why my brain won't remember it. But there's one semester or one trimester where we don't take x-rays unless it's an emergency.
It sounds more like, it just makes more sense to do it at the last one for some reason. Not to do it. Yes. Do you like Crime Junkie podcast?
I do. I've tried to listen to a couple of them. I would rather watch it on TV.
Yes, I do too. Like I tried listening to those on a podcast, but I feel like there's something about it that you just want to. I don't know. I like a visual.
I need
better.
like the police tapes.
Yeah.
You see like the real stuff.
Yeah, or like the actors actually playing it out. I don't know.
Sometimes they're a little lame, but
yeah. A little dramatic with it, but still, a little something. See, I was gonna put this question up here, but Jaime is not going to take this question away from me because that's one of the ones that I definitely
No.
wanted to ask her.
He's still got time.
No, this is my question. What type of patient were you as a kid?
I was the patient that I want to like. I was not a good patient when I was a kid. I don't ever remember like trauma. We would go every 6 months, and I'm sure the hygienist was like, "Remember 6 months ago when I told you need to floss and you're not flossing?" Yeah, that was me. I had a lot of dental work done when I was younger and as a young adult. Yeah, I was one of those patients.
Dang. See,
I like to snack. I like to drink Coke, like Coke solid, like the real Coke, not any Coke Zero, but like Coke. And the sweet tea. I grew up on sweet tea. Snacks.
But all that is bad for you. Like, well, I've been told.
Yeah.
All that sugar, all that, all that acid and whatnot.
Yeah.
But here you
That
are.
was me. Mm-hmm.
What advice would you give kids who are who want to go into the dental field?
Ooh, that's a good one. Do you like science? Do you like science classes? Does blood freak you out? If blood freaks you out, then it's probably not going to work. Yeah. I don't know. That's a good one. I would say shadow. Like, find an office where you can follow the hygienist around for like 4 hours and see if you like that.
Okay.
Because you may not like it. It's not an easy job. I mean, we're sitting down all day, but it's very hard on your body.
Really?
Because the small muscle movements that we're using, and you have to sit, a certain way, and it's hard.
For a certain amount of time, I did hear that you have to sit at almost at a one position.
Yeah, and you're using little bitty hand muscles all day, and it's hard.
Wow. Man, there was a question that I was going to follow up with this one. How is the educational process? Oh, hold on. Before I ask that, my friend Amy wanted to ask you: drink Coke, tea with straw, so it don't get on your teeth. But yeah, still bad for your body.
So the thing with the straw is for stain. So the stain won't necessarily get on your teeth, but it's still going to change the pH of your mouth. So you're still getting the acid.
The acid in there?
In your mouth. Yeah, you're still getting that.
I didn't know. Well, there you go, Amy.
Trying to cheat it. Gag reflex? Yes. I have gag reflex.
Oh, wow.
But I have a topical spray that I just, and it kind of numbs it up, and it helps.
A numbing spray?
Yeah.
Huh.
Yeah.
I am intrigued.
Yeah.
How was the educational process?
I took 2 years worth of prereqs. So like your anatomy and physiology, medical micro, English, all the histories, algebra, chemistry. There's some other stuff that I'm missing. So I took all of that before applying to hygiene school, and then you had to apply to hygiene school. And depending on how well you did in the prereqs, gives you points to rank for to apply. It's pretty competitive to apply, depending on where you apply. And then you get into hygiene school, and it's a whole nother ball game, because then you're doing harder classes, and then you start adding the clinical aspect into it too, and it's hard. It's very hard.
Jaime said there's like a spit reflex that they spit straight.
Oh,
have you seen that?
Where they gleek? I'm not gonna do it, but like I'm talking right there. Yeah.
Yeah.
That happens. And it comes like right at your face.
Oh man, that's disgusting. I'm still mad that I didn't make it into the program. See, I told you she was trying to do it in the past because she really wanted to be a dentist at some point in her life. But then she's on like, I don't think I want to do dental hygiene. But
how long? See, I feel like I want to have a whole conversation with her about like, I want to like, how long ago did you apply? Where did you apply?
You should ask. Maybe she'll pull up these answers as fast as you can. Jaime, meanwhile, put microbiology.
Medical micro was my absolute favorite class. That's one class I would take. I would take it again, like right now. I loved that class, and it might have been because the teacher I had was amazing.
Uh-huh.
And I felt like after I got done with that class and I made the A, I was like, I felt like a bad. I was like pumped. I was like, I can do this.
My wife told me about that state exam, the one we were talking about before the episode started, the one that she told me that she was so freaked out about. I don't know if that discouraged her or not doing, the program.
The board exam?
Yeah, the board exam.
Your
that's
licensing? The licensing exam?
Yeah.
That is a very stressful one. Like, I'm not even gonna lie, I was stressed. But you go through, like, all the stuff that you go through school, it prepares you for it. You are prepared for that test by the time you have to take that test. Okay. You're still gonna stress out, but not very many people fail the board exam. They fail the clinic part of it, but you can take it again.
Belen said, I applied at UT, Lone Star, and Pima.
Dang. I'm trying to think of what test you had to take to apply. Well, every school is going to have a different...
It's like an entry exam or something?
Maybe. Or it could be where she was ranked.
Probably. What type of test was it, babe? And while she answers that, Jaime
that's for dental school, maybe.
DMAT?
If she was applying for dental school, I think it's DMAT. I know there's a dental test. We didn't have to do that though.
Oh, while we wait for her answer, we're gonna go ahead and ask you the last question that I have, and that is, what advice would you give your younger self?
Oh, there's so much. So Shawna now is not the same Shawna 10 years ago. And I guess that would be the younger self that I could talk to. That just like you can do hard things. You can do, you can do hard things. The Shawna 10 years ago was not confident. I was stuck, and this is how my life is, and this is what it's always going to be like. And there's nothing that I'm going to be able to do to change it. And then it took my husband telling me, go back to school and do something else, and then really just pushing me to take the courses and to actually do it. And then I was like, oh, well, I can do this.
There we go. Very supportive husband. As a matter of fact, I wanted to tell you this. First off, I want to ask you a very personal question. How long have you and your husband been together?
You were breaking up. I think you were asking how long have we been together?
Yeah, how long have you and your husband been together?
We've been together since 2007, but we've been married since 19. I think about that. Oh,
okay.
So I was married before.
You've been together for many years, though.
Yeah. We've been together for a long time.
I like how he was very kind to you right now. Like, he's all like, okay, I'm gonna leave you alone. I'm gonna give you a kiss.
Oh, yeah.
I love how he did that. I love how he did that. I was like smiling on my side because I was like, man, that's a good husband right there. I want to be.
He's
I want to
my
be
top
like him.
fan.
He's
my top fan.
Yeah, that's awesome.
He's good.
Oh, but that said, I do miss looking at teeth all day. It was the Hesse test.
The Hesse test? I don't remember the Hesse test. I took, but it's been a minute. When did you apply? What year did you apply? Maybe that would be the.
I think I could tell you. I think she applied at like around 2017, 2018.
Okay, so that was right after. I think that's like their entrance.
That sounds like
Boo.
2016. I'm sorry.
Okay, so that's when I graduated. I did take a test to apply to Lone Star, but it was like included in the ranking system, like how many points you got depended on where you were at. And then they only took the first however many to interview.
Oh,
So maybe that was the points.
I think that may have been
So like
it.
if you got an A, you got so many points. If you got a B, you only got so many points. If you got a C, you should probably retake that because you're not going to get any points.
Yeah, gotcha. Well, Shawna, I think we hit the last of our questions.
That was fun.
You made it.
Yeah.
It was great. If you guys want to follow Shawna, her Instagram is right under her name, or wait, on top of her name.
No.
It's that. There's her Instagram right there. I've seen plenty of her videos. She's very fun. She does a lot of fun videos, so she's very active on Instagram from the looks of it. So yeah, you guys go follow her, give her a follow, say hi. Jaime said thank you so much. Love the episode.
Thanks for the questions.
Yeah, absolutely. Yeah, Jaime took a lot of them, but yeah, he made the episode more interesting. Shawna's top fan. That's her husband right there.
Yeah.
Hey, seriously, I like the way he was. I like this energy. This episode was great. So hey, I got a lot of great feedback. So
Nice.
Thank you so much for being a guest. Thank you for agreeing to this. I greatly appreciate that. I learned a lot from you. Hopefully I do see you soon because let's be honest,
it's gonna happen.
it's gonna happen. We're gonna manifest it.
I know where you're at now.
I should have never said anything.
You can't block me on Instagram. I'll get Lee to find you.
Yeah, we'll definitely make something happen then. I'll definitely keep in touch if we ever need any dental work or dental questions. Like, hey, Shawna, my mouth went numb. Should I be worried?
Maybe.
I'm gonna drag him over there.
Drag him. As any loving wife would do.
Pretty much. But thank you so much. I greatly appreciate you being on here. You educated a lot of people, and as well as myself. So I know this was a very interesting episode, and I don't know what to say, but I don't know what else to say. But thank you so much for being on.
Thank you for having me. It was fun.
Awesome. Well, I'm gonna let you go because I'm pretty sure you have to be up early, and we're about to hit 11. Go ahead and
7:30 patient.
There you go. All right. Well, you have a good one, and like I said, I may see you soon. I'm gonna say goodbye to everybody while you go. Thank you so much.
All right. Shawna. Thank you.
Bye.
Bye.
All right, guys. That was a very successful episode with Shawna Greer. It was my first time meeting her, and quite honestly, she was awesome. She was great. I love the energy. You know, you guys saw that first time meeting her. Great episode. One of my favorites by far because of how interesting and how much I learned, honestly. As you could tell, I had a great time. Of course, I was getting put on the spot a lot by the wifey, but hey, it happens, right? That's what wives are for, I think. I don't know. But yeah, guys, sorry, my contacts are dry. This fan is like hitting me directly. I had a fan on. It gets hot in here. But yeah, guys, another successful episode in the books of Major Listen. Had a good amount of people viewing this episode. If you are still watching to the very end, thank you so much. I still got comments coming in. Are you really gonna go? Look, man. Belen's gonna make me go one way or another. So I know you guys are probably thinking like, oh, you probably said that just because she was here. I'm like, no, like you guys don't understand. Belen's gonna make me. I'll let you know when that happens, but most certainly for a fact gonna go. Belen said, I renewed my license as I watched the episode. Oh my god. Great. What happened to the big former? I'm gonna go back to the dental. Man, guys, thank you so much for thank you so much for the conversations, for the comments coming in, for the great time. I'll go live to prove that he went. Proof that he went. See, she's gonna drag me. She's not playing with that. You guys may think she's playing, but she's not. But yeah, I had a great time, man. Good episode. It's 10:45. I still got comments coming in. It's good to have a backup. That's true. She's talking about her license, by the way. Let me see. I'm just trying to close out this episode. Oh, yeah. So, man, I have to get with my boy for next week, see if he can make it. I'm not going to go ahead and tell you guys what the episode about next week is going to be, but of course, I let it know the day before. So I'm going to do just that. I'm going to bring my boy Bodie in the building. See if he's still on for that. But yeah, guys, thank you for another successful episode. That was a good one. I really enjoyed this one. Well, I got to go ahead and call it good night. I'm about to pull the trigger. Oh, I got 2 comments coming in. Hold on. Do you have an outro saying? I really don't. I really don't. I'll go live next week. You got to let me know ahead of time before you go live. Berlin went live last Sunday. Last Saturday. You guys check that episode out. Like I said, that was, of course, her episode was only for mature audience, so please choose wisely. You need to make one. Hey, if you got an idea of how to, what to do, let me know. That we can go ahead and do one. Try it out right now. What? I just have an outro video that I do. That's all I do. I pull the trigger and bang. That's it. Which I'm about to do in 5, 4, 3, 2.